Hi, I am Dr. Rajasekhar M R from Chirag Global Hospitals, BTM second stage, Bangalore. Many people will ask, what is bloating? Most of the bloating is because of the gas formation. So, gas, where does it come from? One is the fermented food will cause creation of gas inside. The other one is swallowed gas. Whenever we are swallowing saliva, whenever swallowing food, a little amount of gas also we swallow. So that is also part of that. People who are very nervous, who are anxious, they will be swallowing more gas. So that also causes bloating. So most of the bloating is because of the gas. Sometimes it is because of the stasis of the even liquids inside the intestines, which causes heaviness and bloating. Is IBS only a psychological disease? Is it all in your head? That's what people think. It's not. That also is not completely true. We call this as a psychosomatic disease. It's not purely psychological disease. Psychosomatic is the mind which acting on the soma. Soma is body. On the body parts causing disease. It's not imaginary disease. They are not imagining. They are suffering. It is a real disease. But it may be triggered by psychological factors. So it is also in the mind. So if you calm down your mind, if you are always worried about it and go on searching in YouTube, searching in Google, ChatGPT, all that, and cause more confusion, fear, anxiety. I may be having this, that will increase the IBS also. So mind also is very important part of management of IBS. Now with so many regarding food, coffee, tea, drinks, so many things, smoking, alcohol, there are so many things which can affect IBS naturally. Because whichever stimulates our brain or stimulates the stomach. Whatever we eat will go into the stomach. See, stomach is as much exposed to the environment as the skin. These are the two areas which are regularly exposed to the environment. So whatever we are eating, it's having effect on our stomach. So nowadays, see, previously we used to have limited choices in our food. Now whatever is available in the world is available everywhere, and which suits us, which doesn't suit us, we don't know. And because of the taste and the color and the other attractions of the food, will make us eat everything, whether we want it or not, whether we need it or not. So we go on tasting this, trying that, all that, combinations, all that is causing a lot of havoc in the gastrointestinal system. So stomach has become a dustbin for all our whatever is available. It is something is remaining, you eat off. Something is going waste, you eat off. Something has a very exotic, so whether you like it or not, you eat. So it has become a dustbin. So there it is struggling. So there is a very harmonized bowel movement pattern. If we eat properly, regular food and local food, which we are used to. So how the system develops is between the ages of say 5 to say 18, 20 years of age, the body will get adjusted to what we are using, what we are eating. So if somebody is eating the local food, it will get used to that, and that sort of enzymes, it will develop all that. And other foods and all, when you start eating later, it may not accept because it will recognize it as something different. I don't want this. It may not be able to digest them, or it may want to throw it away. So when we go on adding all different types of food in later part of our life, we'll have issues with that. So that is what is happening. Usually this IBS and all will start when people go to college and start working or going out of their places, working somewhere, going abroad, going to different places from where they were used to. So this will upset the whole this one. It takes a long time for the stomach to get adjusted. So abuse of our food is causing the problem. So better to control the food and prefer the local food which we are used to from childhood, and occasionally for taste or for some change you can have. But regularly if you are changing your diet just because it is good for health, something like that, all bombarded with all unnecessary knowledge, unnecessary facts, and we try to do this is good, daily night you have to drink this, you have to eat this sort of dry fruits, that sort of nuts, all that thing. Don't get carried away with all that. We don't require any knowledge for eating. In fact, it is causing more problems. Which animal studies book and eats food? They know what to eat when. They know when to stop. Only we are struggling because we are overloaded with all unnecessary facts and unnecessary information. So if you remove that, our body gives us the correct this one what it needs, what it suits. What food suits us, our body knows. Doctor doesn't know, the dietitian knows about it. We have to try and see, and then when we know that this is what is not suiting us, we have to stop. So you similarly, how much to eat? If people say coffee is good, somewhere they would have read good for bowel movement, they go on drinking 10 times, 20 times. That is wrong. So you must use common sense, you must use your intuition, your body's language, you must learn what the body is telling you. When you are hungry, you must eat. When it is full, you have to stop. That also has to be told nowadays. So all these lifestyle changes doesn't mean that you have to have some exotic things and practice so many yoga, all those things. Use common sense first and follow the natural way of living. So most of these diseases will settle down.